Hi everyone, I'm Lise and I'm a clinical hypnotherapist. What I want to do today is explain hypnotherapy, how it works, and just giving you a little bit of an overview of some of the uses. So hypnotherapy is a form of psychotherapy. It can be used in conjunction with counselling or as a standalone intervention. So basically what happens in hypnosis is that a client is taken and guided into a deep trance. And once they're in that trance, the therapist can then work with the client to help them make the change that they're looking for. So the way in which this is done is that the therapist will use various guides and relaxation techniques. They will use visualization, or they'll get the client themselves to come up with their own mental and physical state. So once they're in the trance, a person can then shut out sort of outside noise, any distractions and any worry as well. And when we're in trance, we are more suggestible. So for that reason, hypnosis is used for a couple of reasons. So firstly, it's used to help people change things that they can't change on their own, such as stop smoking, eating better, social anxiety, biting nails, all of those habits that are really difficult for us to tackle on our own. So the therapist acts as a facilitator by working with the subconscious mind. The second part of hypnosis, or the other use, is around analysis. So sometimes in counselling, it's really difficult to get to the root cause of an issue. So hypnotherapy can be used to allow us to look at something like the root cause of an eating disorder or an addiction, taking through hypnosis and tapping into painful memories and unravelling and resolving them in a really safe environment. In this instance, I would always, as a hypnotherapist, recommend that counselling is used alongside it. But hypnotherapy has a broad use, lots of applications. So it can be used for general stress and anxiety, phobias, habits like stop smoking, weight management, performance and social anxiety. It all can also be used at the flip side of that around sort of performance enhancement. So for sports people, actors, it's used for insomnia, pain control, depression, helping overcome grief and loss, childhood and adult trauma, addiction and sex therapy. It can't be used with people that have psychotic feelings or are in an altered state. So anyone that has sort of hallucinations or is in a delusional state, hypnotherapy won't work for that reason. You should always use a recognised professional who's part of one of the professional bodies. And a full case history should always be taken by the therapist, regardless of what the therapeutic technique is going to be. I also, as a hypnotherapist, expanding my knowledge at the moment, and I'm moving into studying neuroscience and mental health so that I can complement both therapies together. Okay, so if you do want to have a consultation with me and know more about hypnosis, hypnotherapy and how it can help you, I can be contacted on kingybell@me.com. Or you can contact me on my Hypno Healing page on Facebook. And thank you for listening.